we get results and compare them to national performance by all other students taking it in at their board exams. All right. So let me start with an example question. So if I drink 1 liter of water, this is not quite 1 liter right now. During the next few hours, what most significantly decreases compared to before? So even my presentation here can be very boring and not engaging. So if I ask you to type in the answer in the chat, don't hit enter until I say 1, 2, 3. You don't have to get it right, but so type in a number out of the 5 and I'll count to 3 and hit enter. 1, 2, 3. Ah, thank you. So thank you very much for answering the question. And do we really care is the question I propose to students, not with regard to not answering the questions, but what the body doesn't care about certain things, but cares more about what the plasma osmolarity is, right? So it tries to really preserve plasma osmolarity and doesn't care about using urine osmolarity. But what's funny is students often get disengaged from class even when we try to utilize these engagement methods. The previous work, also done in collaboration with Dr. Vuk and Dr. Anders, was in renal physiology in the renal module. There were 6 hours previously taught in 2017 and 18 without these ARS questions, and taught with these ARS questions in 2019 and 2020. As we all remember, 2020 was all online, and ARS questions were added almost 1 question per 3 minutes of content delivery. The graphs here show the first 4 bars show the renal physiology scores in reference to the national mean. And the first 2 years when ARS was not given, it was below national average, and it increased significantly better in 19 and 2020. And for the same group, questions that came from renal non-physiology questions were not changed. And when we polled the students and asked, did you think interactive retrieval practice in online classes helped you learn renal physiology? 97% agreed, 3% were neutral. Okay, so that seems pretty good. But as mentioned, even when we put in ARS questions, it's not always possible to capture everybody, partly because the lectures are recorded. So the next year, 2021, we had this study design. That year, we only had 165 second-year medical students, and they took 7 MBME exams in 4 consecutive modules. For exam 4, there were live and self-paced polling on 3 separate days, incentivized for completion. They received the small amounts of points for completing those. So we analyzed their responses and determined whether they were actively engaged in answering those on all 3 of those days. If yes, we called them active group. And there were about 46 students that were not engaged in at least one of those 3 days. The way we defined engagement was if they got 33%, at least 33% of the questions correctly, a little bit more than random chance, okay? And then within the active group, since we were giving it in live session, but also in recorded lectures as self-paced polling, we divided that group to mostly live or self-paced. So we have three groups: group one live, group two self-paced, and then group three inactive. The way we approached this question, research question, was we will analyze the performances on these exams as a quantitative measure. And then we asked a single question: how did the self-paced polling affect your experience with the recorded lectures? And did qualitative analysis to that survey. First, the quantitative result was the, the graphs look a little confusing, but there were three groups, as you can remember. Group one was live, group two is self-paced. We compared their scores above the average of the inactive students' scores. For exams 1, 2, 3, 4, 5, 6, 7, for all 7 exams, the live group performed better than the inactive group, and that was not a surprise. Interestingly, the self-paced group performed better on that exam 4 alone when incentivized polling was available. Interestingly, for exam 1, live and self-paced polling was offered without any incentives. As you can see, the self-paced group didn't perform better than the inactive group for that exam. So that was the quantitative analysis. Then the qualitative analysis, we looked at their responses, and two of the three collaborators extracted common themes. We mentioned that we defined engagement as effortful learning, and it had 3 dimensions: emotional, behavioral, and cognitive. Most of the responses showed some form of emotional engagement, saying, love this, and such. And the behavioral aspect, what we were looking for was that they were motivated to do things and keep up with the work instead of just putting it until, or not doing it until the last minute. And the cognitive aspect was they actually had time to stop and think about it. And most comments were positive. There were 115 positive comments compared to 12 negative comments. Among the 12 negative comments, 5 of them said, oh, I only did it for points. And then 4 of them said, oh, well, self-paced polling was okay, but live is better. And 3 said, had some negative comments, but was non-specific. So that was the qualitative analysis. And the lesson we actually got from this, I feel like, was this theory about nudging, right? Sometimes we treat students as adult learners, sometimes we don't. But even as adult learners, I think they can be nudged into better engagement. So nudge theory, immediate reward is a good thing. And then fear of loss or trying to avoid loss is also a motivation. And online games, social media, and all of these big companies use these methods. So why not use it for education? So we're talking about giving small rewards that can result in change in behavior. So takeaway points: incentivized polling questions in recorded content may enhance the 3 dimensions: emotional, behavioral, and cognitive dimensions of engagement. And offering completion points as incentives, we didn't actually grade them, but just completion points may increase active participation and exam performance. However, this may not be for all students. All right, and here are the references, and I'll take any questions. Thank you.
Dr. Ree, I have a question.
Yes,
You,
sir.
your background is as a biomedical researcher in the basic sciences, pharmacology and toxicology. And this project is an educational research project, which has now become a focus at Kaiser Permanente. Education, your focus in education. So can you tell us some of the differences that you see, have experienced in approaches to research for biomedical research, which is basically the scholarship of discovery versus the scholarship of teaching.
Hmm. Yes, that's a great question. So my career transitioned from research into education, and I almost feel like part of the reason I transitioned to education completely was because I was involved in this scholarship of education or teaching. But what I felt was there was the languages and the methods used in traditional biomedical research versus educational research was very, very different. And it was almost a shock to me. Initially, the first educational paper we tried to publish, and Dr. Anders helped me on this also, took almost 3 years to publish. And that it was like I'm learning this whole scholarship for the first time. And the second one took 3 months to publish, and this last paper took 3 weeks to publish. So I feel like I got used to the language, but the big difference is I think we are focusing on teaching better first, and educational scholarship almost or research comes almost as an addition to our main focus of teaching. So sometimes this second part gets ignored or not ignored, gets pushed aside because we are focused so much on teaching. So I don't know how to add, whether that's getting close to your question, but
That's very helpful. Thank you. Quick follow-up question out, then we have time for a couple other questions. Um, you mentioned it's teaching first when you do education research, and I wholeheartedly agree with that. It's really first and foremost about about learning, about the students learning. And in the teaching process, you're very integrated with the learners, which is very different than research, where you're objective and not really involved with the subjects or in the lab. You're very objective rather than being integrated with the participants. And so it's with any sort of educational research, the teacher is also very important. The style, the motivation of the teacher, so on and so forth. So how can you speak to the generalizability of what you've done, given that, as I mentioned earlier, you did receive the award for the Chancellor's Teaching Award, so you obviously excel in teaching. So what about how do you help people translate what you've done to help them in
right.
their setting?
Yeah, that's a great question. I think the answer to that comes from the faculty who are in this meeting as well and still teaching those courses. I think Dr. Jensen and Dr. Takali are all here, and they continued using all of these questions in their delivery and such. And I believe they had great success with it also. And I believe Dr. Jensen, who took over the course after me, actually made it even better um, by making students do it all in live sessions rather than self-paced. But the success and continued success of this method at UAMS, I think, speaks loudly about how well this could work.
Any other questions or comments?
Yes, Dr. Stickley.
I have a question. Sung, I noticed that in one of your slides that had the two graphs, the self-paced group and I forget what you called the first group, had over the 7 modules. There was considerable overlap within the two curves.
Yes.
How do you interpret that?
So this is okay. So we divided these groups to live and self-paced based on the analysis for that particular module, renal module, the middle part. What they did in previous modules, we don't know, actually, right? We're simply comparing how they studied in those different modules, we don't know. So if previous modules didn't provide ARS questions at all, their study habits may have been the same. And that overlap. So the grouping is only from what we observed in exam 4. And we're simply asking the same groups, how did they do previously? How did they do afterward? When this intervention was not offered. So it's not a surprise that the groups overlap in those different for those different exams. Let me see if I can pull up the slide here. So you're talking about this slide.
Yes.
Yeah, so again, the grouping was made based on the statistics that we saw, their answering patterns for exam 4, or the sessions leading up to exam 4. These other sessions did not have those interventions. I hope that makes sense.
Yeah, but are you saying there's statistical significance between the two groups in the module 4?
There is statistical difference between these two.
Yeah.
Between live and self-paced?
Right.
No, there isn't.
Okay. One of the things that you might want to consider doing at some point is making the self-paced truly self-paced, and that is requiring competence along the way before you progress to the next section.
Can you elaborate on that?
Well, you have your questions that come, every so often in the material.
Mm-hmm.
If they don't get
I see.
they go on to the next section.
I see. Well,
Hi, it's
so
Alan.
I remember that voice.
Say that again. It's kind of faint. Okay.
What I'm saying is, this in some ways, this is an update of technology of what used to be called machine learning back in the 60s. And one of the things about machine learning was it allowed students to learn at their own rate. And if they only could progress to a next level after they have shown that they have truly mastered the existing level.
The volume up. No, the volume on my handset was turned down.
Alan, could you?
Is it better now?
Okay, yes, I understand.
Okay, am I better?
Galen, so there is a method to the way we were giving it at UAMS with the recording in place, and then the self-paced polling was simply a separate program that you run. So it wasn't linked. The recording and the questions weren't linked. So we couldn't really do what you were suggesting. In other software, such as Panopto, where recordings can have embedded questions, then there are options where you can choose.
Put in prison.
There are options you can choose.
Yeah.
Where
Life
can say,
360 has been put
don't
on my
let the
phone,
video play unless you get this question
which,
right or wrong, or answer the
other than
question.
going to your
But
place,
the
is
way
not
we
an
were
issue.
presenting, we couldn't actually do it because
The
it was a
I
separate
have
separate
not been
application altogether.
questioned much. Joan is being very quiet. Katie is
I'm
Okay,
so sorry. Alan,
I
could
think
you please
we're
mute?
gonna, yes, Dr. Dickey, if you could mute your mic, that'd be great.
She
And I
has
think,
imposed all sorts of stipulations,
Dr. Dickman, if you could mute
which
your
I
mic,
have,
that would be
like
great.
Life 360.
And I think our time is up. We're gonna move on to Dr. Stickley.
One of the stipulations was that I was supposed to sever all contact with
Who is
you,
the host of the meeting? I
and-
believe the host can
and,
mute any participant.
block you on my phone.
Yeah, if you
Now,
just
you
go to
both have been deleted
participants, you
from
can
my
mute
phone, and
him.
I did that before you were
Okay.
formed, but
Dr.
not
Stickley, if
blocked
you'll
on my
load
phone, but you
your,
are deleted.
Dr. Dickman, please
There are
mute your
ways to
mic.
still contact me. My
Okay.
Gmail, probably you can.
How do I mute him?
But
If you go
Right
to the
click.
participants,
not really
click
sure
on
how the voicemail
participants
works
and you
anymore.
can mute him.
Okay, I see.
Well, that's what I'm called.
Can you let me know if you can see my screen?
There we go. We're good. We see it, Kimberly. Okay.
Okay.
Next up is Dr. Kimberly Stickley. Dr. Stickley is a clinical assistant professor in the College of Nursing here at UAMS. And Dr. Stickley will present Koru mindfulness training in nursing students, weathering the perfect storm.
So thank you all so much for attending, and I'll just get started. So the background of my study, which was conducted through teaching scholars, and it did occur over several years as well, as Dr. Ree was saying his did. Nursing is stressful work. There's nursing shortages, it's shift work. We know that patients have gone to a higher acuity patient, and stressed and burnout nurses can endanger the quality of care and patient safety. But nursing school itself is also very stressful. There's a high psychological demand. They have to gain vast knowledge at a really fast pace and be able to apply it. It's not just gaining knowledge, it's being able to apply the knowledge. Plus, they have clinical experiences where they're going into patient care settings. They have to navigate healthcare systems. And then they interact with vulnerable patients and families. And they see it sometimes, often for the very first time. And then they also have nurse preceptors that are stressed. Nursing students do suffer anxiety, depression. They're stressed out. And so there is a critical need to look for strategies to help weather this kind of perfect storm. Often what we do is we kind of recommend self-care for people and say, hey, it's a really good idea if you take care of yourself. But do we actually train people to take care of themselves? And do we require self-care behaviors? A potential strategy is mindfulness. Research has shown that it decreases stress, anxiety, depression, and burnout. And what mindfulness is basically being able to pay attention to the present in a really non-reactive, non-judgmental way. So that's the foundation of this study. The purpose of our study was to examine the impact of Koru mindfulness training on the facets of mindfulness. Our goal was to see if it was a feasible way, if this training was a feasible way to enhance pre-licensure students' wellness overall. My personal goal was to see if we could provide tools in self-care and train in their uses. And is this an effective strategy in increasing student resilience and subsequently helping to build a more resilient workforce? The conceptual framework that we used, Koru mindfulness itself is a framework. But our measuring framework was the 5 facets of mindfulness, and that's observing, describing, acting with awareness, non-judging of inner experiences, and non-reactivity to inner experiences. Our methods were, the setting was an academic health science center, so here at UAMS, and it was my course. I teach the psychiatric mental health course in the College of Nursing, and so that's where this occurred. The participants were third-year baccalaureate nursing students, and this actually was a course requirement. It constituted 5% of their grade. Our study design was mixed methods. We had a single group. It was just this cohort, but we did do repeated measures throughout the course and the semester, with our final data collection at the very end of the semester. And we had conceptual content analysis with our qualitative data. Our procedures were, we had 8 certified Koru mindfulness instructors, and just a little bit of information about why we chose Koru. Mindfulness-based stress reduction is another secular mindfulness training, but it's more extensive. It's 8 weeks of training as opposed to 4. There's 2.5-hour meetings, and then there's homework during the week. And when we were introduced to Holly Rogers, who was one of the creators of Koru Mindfulness, she had done a lot of research on how to keep college-age students engaged in the training. And so Koru is 4 weeks with 75-minute training sessions via video conferencing, and then the students are just simply asked to practice 10 minutes a day. They also obtained a digital copy of her textbook, The Mindful 20-something. The students were able to pick one of the 8 courses taught at different times throughout the semester, and each class of training was approximately 12 students. Our outcome measures were, again, pre and post-training comparison of the 5-facet mindfulness questionnaire. And what we were looking for was changes in each of these different facets. This tool, the FFMQ, is a validated tool, but what we found was we also were able to demonstrate very good internal consistency in our sample. We also had the qualitative inquiries. It was just simply 2 broad open-ended questions. Has the mindfulness been helpful to you, and how helpful was Koru mindfulness? Has it been to your patients? And then we had, of course, descriptive statistics expressed. These were demographics, and then we also looked at student satisfaction with the educational experience. The analysis, we had a paired t-test comparing pre and post-training scores for those facets of mindfulness, as well as overall a total mindfulness score. And then the content analysis explored their qualitative responses. We had 4 raters that worked on this. 2 were Koru mindfulness certified trainers. 2 were neutral. One was Dr. Whitehead, who's a nursing administrator here in the College of Nursing. And then we had Dr. Anders from the Office of Educational Development. What we found was that we all ended up coming together and had a high inter-rater reliability. And these are our results. So all the students participated in the evaluation process because it was part of the course. They were told when we surveyed them that there was no points associated with that. We protected our vulnerable population. But surprisingly, to our great joy, they all actually did participate. We did lose some of our data because only 57 of the 97 students were matched based on their identifier code. So for us to be able to follow them throughout the course, that was about 60%. And here's our results. So 1 would be highly dissatisfied, 3 is neutral, and 5, of course, highly satisfied. And if you look at satisfied or highly satisfied, about 80% of the students would recommend this training for other students. The overall quality of the training was positive for about 80%. And the ability to apply what you learned was also about 80% of the students. Was it relevant to your needs? About 60% said that it was. And then was it helpful for you? About half the class felt like this was helpful for them. This I find very interesting because we surveyed, are you practicing mindfulness? And if so, how often? About 60% of the students said that they're regularly practicing mindfulness. And if you remember that the very last of our data collection occurred at the very end of the semester, for 60% to be regularly practicing, I felt like that was significant. 5 facets of mindfulness, the pre and post training. If you look at these, I wanted to just briefly explain, go into a little more detail about these 5 facets. So observing is actually the impact of external stimulation on your feelings and thoughts. Describing is being able to characterize your feelings and thoughts towards those experiences. Acting with awareness is acting with a focus on what is presently occurring. Non-judging of inner experience is just basically what it says, having a non-judgmental attitude about whatever thoughts you're having or feelings. And then non-reactivity to inner experience is just not reacting to the emotions, the feelings, your thoughts. And non-reactivity to inner experience is also directly linked to resilience. And if you look at this, you can see that we did have statistical significance in 4 of the 5 facets, and then also in the overall mindfulness score. So the content analysis is demonstrated here, and we did a top-down deductive analysis using the basically given set 5 facets as our main themes. And then we did an inductively, we identified these sub-themes, breath awareness, self-awareness, communication. And these are just a few examples of the quotes that our students gave us. And whereas you could go back and look at the, say observing 0.64 to 0.68, that it was statistically significant, but it's small. If you're thinking about what's happening here, this is a behavioral change. And many of us understand that behavioral changes are hard. But this can be applied clinically. And I think all of us were kind of blown away by the comments. I love this non-judging of inner experience. I can separate myself from the situation and give compassionate care without judging. How powerful is that? I can control my test anxiety better and have stress relief from nursing school. So I felt like these were clinically significant. In conclusion, given that the 2 broad open-ended questions lacked any reference to the facets, their responses that we read are very remarkable. Post-training, again, 4 of the 5 facets were improved. There was an improved overall mindfulness score. And then short-term implications for this. This could potentially help students cope with the stress and anxiety as they face the challenges of nursing school. Long-term implications, very much. This is for their future nursing careers. It could help balance the roles and responsibilities through increased non-reactivity, and potentially help them be resilient to burnout. And then as nurse educators, this is feasibly a way to actively integrate student wellness into your curriculum. We also recently found out that we have received funding and that this training is going to become a permanent part of the course. So overall, was positive. There's my references, but I do want to talk just briefly about the teaching scholar takeaways that I got from this. This was a very new experience for me. It was actually the first time I had done any kind of qualitative analysis. Of course, we had a biostatistician to do our quantitative, but I'm a sanguine person. An ideas person, eternally optimistic. And so, but my follow through can sometimes be lacking. And what I learned was you have to do the work and you have to schedule time or nothing really gets done. I'm an educator. My heart is in education. But I also like practicing with evidence-based. And so I could have easily just said, hey, I think this is a good idea, let's do it. But with the help of teaching scholars, I was able to demonstrate statistically that it is helpful. You really need a team to do this. Of course, I had Dr. Mike Anders, Dr. Teresa Whitehead, and Miss Amber Teagan from Health Professions, College of Health Professions. I'm a big picture girl, but it's made up of tiny, small pieces. And the other takeaway is that I'm going to pursue more training and understanding of this whole process. So overall, it was a really good experience for me. And I'll stop sharing and see if we have any questions. Thank you.
I have one question quickly. I know we're going to run out of time, but thank you for your presentation and for the work you did on this, which is, I think, helpful for all of our colleges going forward. But how do you see this work being used in the current workforce?
Wow. Well, I've been a nurse for 33 years and I've been in the trenches, as we'll say. And so what I really wanted to do was teach students from the beginning how to take care of themselves, how to be resilient so that hopefully they'll have long careers. And I just kind of think it's uncool for us to really recommend, hey, you should take care of yourself, but not require students to take care of themselves. And so in doing so, and not teach them how to take care of themselves, in doing so, I'm hoping that it will carry over into their work career, that they'll be more resilient in their work career and have a long career.
Thank you.
We have time for one more quick question. Briefly, Dr. Stickley, talk to us about this non-reactivity to inner experience. There was the largest effect size with that and some very compelling qualitative comments. So how important is that?
Oh, yeah, I think all of them are important. And that's why I wanted to give those definitions of what they were. But being able to be non-reactive, resilience is simply being able to tolerate harsh or difficult situations without it impacting you internally. And nursing is difficult and stressful. And so the ability to not react and non-judgment is a significant part of that too. Being able to be aware of what you're actually experiencing, feeling, thinking without judging it and without reacting to it. I hope that answered your question. It's just important when you work in harsh environments.
Thank you. Thank you for your presentation.
Thank you for having me.
Dr. Tucker and Ms. Rose, would you please load your slides and I'll introduce our next presenters. Dr. Claire Tucker is an associate professor in dental hygiene in the College of Health Professions here at UAMS. And Miss Rose, Brittany Rose, is an instructor in dental hygiene in the College of Health Professions here at UMS. Dr. Tucker and Miss Rose will present emotional intelligence, professional development, the pilot study.
Hi, thank you so much. So my name is Brittany Rose, and like you said, along with Dr. Claire Tucker, will be presenting with me today. And we also have the help of Dr. Anders, of course, we're so appreciative of. And so we have the pilot study on an emotional intelligence professional development course. Kind of goes right along with what we were just hearing about with mindfulness as well.
Hey, Brittany.
Yes.
I don't think the slides are showing.
Oh, I'm sorry. One
It's
second.
okay.
How about now?
Yes, that's great.
Okay. Now back up. Okay. Now we're good. Okay, so probably most of you as faculty have heard a lot about emotional intelligence. It's very important in all aspects of life. So there's a lot of research out there, and it kind of became a trend and a buzzword there the last few years, hearing a lot about emotional intelligence. So the majority of the research regarding emotional intelligence really breaks the categories down into these 4 different dimensions. Self-awareness is really how we notice and understand our own emotions. How aware are we of the emotions in ourselves? Self-management is how we effectively regulate those emotions. So you got to be aware of them, but then also be able to regulate them well. And then social awareness, of course, is recognizing those emotions in other people and those around us. And then the relationship management is how well we take all of that information to help us effectively manage the relationships around us. So there are a lot of benefits to emotional intelligence. So just in general, individuals who have high emotional intelligence are typically just able to better handle stress, just everyday life stresses. We have better, more meaningful, close relationships, more socially competent, and then just general levels of well-being are higher all around for those people with higher emotional intelligence. So for faculty, it's even more important. Faculty members who have higher levels of emotional intelligence typically experience less burnout. They have better emotional connections with their students, which increases our own job fulfillment. Also, helping us collaborate better with colleagues. Emotional intelligence really can help us communicate better with everyone around us, and that eases those communication barriers that we might have sometimes. And it just overall is eventually going to make us a better and more effective educator as well. So you can imagine this is also going to be beneficial for our students. So on the opposite side of that, our students are also going to feel more connected to the faculty. It kind of bi-directional. It's going to help them manage their stress better related to academia, especially in the dental hygiene department where I'm at, where they are going to also be in the clinic working with patients hands-on, is really going to help them there, but also shows improvement on grades in the long run as well. Helps increase their critical thinking and problem-solving abilities, and even increases motivation and self-regulation and teamwork. So you can see where this might become really popular or really important for us to evaluate. So the goal of our study was to evaluate an emotional intelligence faculty development course to see if we could increase the dental hygiene faculty members' emotional intelligence. And hopefully see improvement in communication skills, the reduction of their stress levels, and increase their confidence with bringing EI into the hygiene curriculum. So we did our study, of course, here in the Department of Dental Hygiene at UAMS, and we had 5 full-time faculty members involved in our study. This was a mixed method study, and so we had surveys that were pre and post. One was the emotional and social competence inventory, the perceived stress scale, and the perceptions of EI. And the qualitative came in where afterwards the faculty members completed some guided reflections. So they actually got to express to us and tell us exactly how they felt that the whatever activity they implemented, how well it went. And we'll talk more about those different activities as well. So the faculty completed 6 online modules. These were mostly self-paced, but we did spread them out. I think it was over a month, 2 months, maybe for these. And it started out with an introduction module, but it just kind of it went over kind of what we just talked about. What is the idea behind EI? Why is it important? What the kind of the end goal was. And then they had a module that related to each one of the different divisions of emotional intelligence. So self-awareness, social awareness, each one of those. The very last module really helped, was focused on how they were going to incorporate emotional intelligence into the curriculum. So we talked about the importance and kind of what that would look like and gave them some activities and things to think about incorporating. Along with the modules, each faculty member also read along in a textbook or a book called Emotional Intelligence 2.0. And it's a really light reading. And so each week, along with the module, they would do a quick reading of a chapter in the book. And that's what really helped them kind of develop their own self-awareness and gave them some activities just to practice to increase their own emotional intelligence just in everyday life. So in the implementation phase, this is what followed up all of the 6 modules. So we called it the implementation phase. So this is where the faculty took everything that they learned and really implemented it. So they were encouraged to design an activity and implement it into their classroom, whether it was once a week or as often as they wanted to really. But the goal was to really have them reflect on that. So what was the atmosphere before you did the activity? What was the atmosphere in the classroom after the activity? And really kind of see, did it affect our students or ourselves in any way in the classroom? And so we got some really great reflections afterwards. We did present this to IRB and determined that we did not need any oversight for this study. Okay, Dr. Tucker.
Alrighty, so like Brittany said, our participants were full-time dental hygiene faculty members. The majority of our faculty, we have younger faculty, so they're between 31 and 40. We have one between 51 and 60, and then one 71 to 80. So these are the results for the emotional and social competency inventory. We did a lot of research on what the best survey was to evaluate the participants' emotional intelligence. And we selected this one because it was validated, but also it really focused on those 4 aspects of EI that we were looking at: the self-awareness, self-management, social awareness, and that relationship management. So you can see all of the, compared to the pre and post surveys, all of the means increased and the medians for every single participant, which is pretty significant because studies have shown it takes years to increase someone's emotional intelligence. So we were pleased with those results. We also looked at the perceived stress scale to just determine what their stress level was before they took the course and then after. We all know that education can be stressful, so it's no shock that all of our faculty members were in the high level. So 0 to 13 is low stress, 14 to 26 is moderate, and then 27 to 40 is high stress. So they all fell between 29 and 34. In post course, all of the stress scores went down. We did have one that went in the moderate stress. They all stayed in the high stress level, but they did decrease. We also did our survey on the faculty's perceptions of EI, and overall all of the results were positive. The faculty felt like they were able to recognize their own emotions and really be able to regulate those emotions, see the emotions in others, and build and maintain relationships. And this was with students and also colleagues. 100% of the faculty members felt like they increased in their ability to communicate with the other faculty members as well as the students. And they all felt confident that they were able to incorporate EI activities into their curriculum, which we know ultimately is going to improve the student outcome. 60% reported that the course decreased their overall stress level, and then 80% said that they were better able to manage their everyday stress following the course. Qualitatively, we analyzed the reflections that the faculty did after they incorporated EI activities into the curriculum. So just looking at the top level codes, we focused in on the EI activities, how the students reacted to the EI activities after they were presented, either in the classroom or the clinic, and what the faculty's perceptions were, and then future directions, what the faculty wanted to do moving forward. So really, overall, it was positive. Faculty felt like students were more engaged, and they kind of worked together to make decisions, and the dialogue was more open. So overall, the communication was more effective. And in the classroom, faculty noticed that the students went from inactive to being really engaged, and the shift in the atmosphere changed in the classroom to more positive. The students were more open to engaging in the classroom activities. Faculty felt that this increased the students' self-awareness, and they became more vulnerable when communicating with the faculty, which ultimately is going to improve their relationships. Looking forward, faculty want to continue to strengthen their EI in their daily lives, but also to improve their ability to educate students. Our sample size was small, obviously, because we just started off with our faculty. And there's a potential for bias with the self-reported data. But overall, we felt like the EI definitely improved with the faculty based on the survey and their perceptions. They felt like they improved relationship with their peers and with the students, and just gave them more confidence to incorporate emotional intelligence in their courses. Emotional intelligence, like Brittany said, is huge, and it really can benefit faculty, but also students. And it doesn't just pertain to dental hygiene, of course, it's all professions. And so we really think that this could be something that could be incorporated into other allied health educational programs, but also in other disciplines. Just our takeaways was it was really great to work with Dr. Anders and to learn from him, and his mentorship was really amazing. We were able to hone our research skills, learning how to design a study. This was my first qualitative study as well, so we learned a lot about analyzing their reflections and just gathering the data and analyzing it. And these are our references. This will open it up to questions.
Okay, we have time for a few questions.
Okay.
If you'll stop sharing, I'll put up the evaluation code.
Hi, Claire. I just have a quick question. What made you choose emotional intelligence to study?
Yeah, so we have found just in our program that students might have the intellectual abilities, but they kind of struggle with the emotional side. And we wanted to first start off with our faculty to make sure that they were able to regulate their own emotions and start kind of be the leader in incorporating the emotional intelligence. Ultimately, we would like for our students to take these modules and go through the course. And we've been thinking about incorporating it before they even start their curriculum, because it won't, it'll help improve relationships with the faculty and peers, but it'll also help with patient care.
I have a question for you, Claire and Brittany. You didn't mention that you actually got funding from the Educational Innovation Intramural Grant. Talk to us about the impact of that grant and how you used that to actually implement this project.
I can answer. So we actually, received a grant from OED, and that helped us both attend a formal course on emotional intelligence, which gave us a lot of background in materials that we were able to utilize to use to make the modules. And then we also got Articulate 360 storyline, and Brittany was able to work within that program to actually develop the modules. So that was a huge learning curve for her, I think, and ultimately it's going to help our program and all of our courses, because she's going to be able to assist us with that. So it's going to be a gift that keeps on giving.
Thank you so much, Dr. Tucker and Ms. Rose, and all of our presenters today, and the participants, those that attended. We really do appreciate it. If you just take a few moments, there's, I think it's 6 questions in the evaluation. We would really benefit from your feedback to improve this webinar in the future. Thank you so much.
Thank you, and thank you to everybody who attended.
Thank you for having me. Take
Dr.
care.
Green, it's good to see you, and thank
Yeah,
you so much. That was great.
we should keep in touch.
We will. If you need anything, let me know.